Good afternoon, Mr. and Mrs. Gray. My name is Lou Howard, and this is Lynn Chen, and we're two of the nurses that'll be taking care of you today.
Hi, Mr. and Mrs. Gray. It's nice to meet you.
It's nice to meet you as well.
Mr. Gray, we're going to go over a few safety checks with you before we take you into the OR. If you'd like to follow along, here is our checklist poster.
Okay.
Mr. Gray, I'm going to start by asking you your name and your date of birth.
Stuart Allen Gray. I was born November 11th, 1971.
November 11th, 1971.
Yes, that's correct.
Mr. Gray, can you show us where you're having your surgery today?
Yeah, it's right here on my right side.
Does the consent say right inguinal hernia with mesh?
Yes, right inguinal hernia with mesh.
Mr. Gray, did Dr. Anderson, did he mark your right side with his initials?
Yeah, right here on my right side.
Okay, for your safety, we're going to have to check to see where he marked. Can you show me his initials?
Sure.
All right, Mr. Gray, when we head into the OR, we're going to ask you to move to the table and lay on your back. So Lynn, we'll have to position him with his right groin exposed. Mr. Gray, do you have any known allergies?
Yes. I'm allergic to amoxicillin, and the doctor told me never to take it again. Right on?
Yes, he's not supposed to have any penicillin-type medicines.
Can you tell me what happened when you last took it?
I broke out in hives, and my lips swelled up.
Yeah, it was kind of scary.
He's going to need a different antibiotic than the one that Dr. Anderson normally uses. We'll probably need to use clindamycin.
I agree. We'll talk to Dr. Anderson. Thank you for telling us that, Mr. and Mrs. Gray. Clindamycin is a different type of antibiotic that we use when patients are allergic to the penicillin-type medications. We'll make sure that he doesn't receive anything like amoxicillin.
Good.
Thanks for asking us about that. I don't want to see that kind of reaction ever again.
Now, your records indicate that you weigh 100 kilograms, which is about 220 pounds. Is that correct, sir?
I suppose.
Okay, thank you, Mr. Gray. Please feel free to speak up whenever you have any questions.
I don't. Honey, do you have any questions?
Oh, will he need to keep taking that antibiotic after we go home?
That's a good question, Mrs. Gray. Usually patients do not need to keep taking the antibiotic at home after this type of procedure. I'll tell Dr. Anderson that you asked me that, and he'll be sure to answer it for you. Please feel free to speak up and ask him yourself when he comes to visit you in the post-op recovery area. And after that, if you have any other questions, just write them down and you can remember to ask him everything.
That's a great idea. I'll do that.
Okay, Mr. and Mrs. Gray, we're just going to step over here for a few minutes to finish our checklist. Okay, Lynn, do you have the implants available in the OR?
Yes, we set aside the mesh that Dr. Anderson requested, and it's already in the operating room.
Okay. Has he requested any images of Mr. Gray?
No, we don't need any images for his case. Mr. Gray is at a low risk for DVT, and the procedure should be under 1 hour, so we shouldn't need any warmers.
Okay, great. The anesthesia safety check has been completed. Mr. Gray's case will be done with a local anesthetic and sedation, and I don't anticipate any airway or aspiration issues. But I'm going to go ahead and make note that there has not been a change in Mr. Gray's cardiac and respiratory history.
Okay. The OR is all set.
Okay, we're ready. Mr. Gray, are you ready to go to the OR?
As ready as I'll ever be.
Okay, honey. I'll be waiting for you in the recovery room.
Oh, Lynn, can you go ahead and page Dr. Anderson, please, and see if he agrees with giving Mr. Gray the clindamycin for this procedure? Mm-hmm. And once we hear back from him, I will start the antibiotics. Mr. Gray, can you lift yourself so that we can help you onto this OR table?
Sure, I could probably do it myself.
I'm sure you can, but we'll work together as a team. Now, once you get on the table, we're going to position you in a way where it's obvious to everyone where your surgery is going to get done.
Well, I have this mark on my groin. It's right where the hernia is.
That's great, Mr. Gray. And that's why we're going to position you so it's clear to everyone. All right, and lay your arm straight. There you go.
Hi, Mr. Gray. Good to see you again. How you doing today? Good. Well, I want you to know that we're going through another safety check before we get started. You may hear us talking about you, but we just want to make sure that we have everything exactly right. So let's start our timeout. Is everyone ready to perform the timeout?
Yes.
Okay. Has everyone had a chance to introduce themselves to Mr. Gray?
I haven't introduced myself to Mr. Gray this morning. Hi, Mr. Gray. I'm Gail, one of the scrub techs here in the OR.
Why don't we all go through and introduce ourselves for one last time? I'm Dr. Peter Anderson. I'm the surgeon overseeing the case.
I'm Lou, the nurse anesthetist.
I'm Lynn, the circulating nurse.
Okay. Now that we've all introduced ourselves, let's talk about our patient. We'll be doing a right inguinal hernia repair with mesh on Mr. Stuart Allen Gray today. The site is on the right side. Lynn, can you hold up the consent form so I can make sure it's a match?
Yes, Dr. Anderson, the consent form matches a right inguinal hernia repair. Here it is.
Okay. Lou, is the clindamycin completely in?
Yes, infusion just finished.
Okay, well then I'll go ahead with my part of the briefing. This should be a straightforward right inguinal hernia repair with mesh. I don't anticipate any problems. Lynn, do we have the mesh for the repair?
Yes, it's in the room.
Okay, well then let's go on with the anesthesia briefing.
Mr. Gray has already received sedation, and you'll be using local anesthetic, correct, Dr. Anderson?
Yes, Lou, I'll be using 30 mLs of 0.25% bupivacaine.
30 mLs of 0.25% bupivacaine.
You got it.
I have no concerns with airway or other items.
Okay, well, Gail and Lynn, will you go through your portion of the briefing?
We have 0.25% bupivacaine on the field, and it's labeled.
And we have all your usual equipment, including the mesh, Dr. Anderson.
Okay, thank you, Lynn. Does anyone have any concerns before we get started?
I think we're good to go.
Okay, well, if you see something that concerns you during the case, please speak up.
Is everyone ready to do our debriefing?
Yes.
Okay. The instrument, sponge, and needle counts are all correct. I've documented the procedure as a right inguinal hernia repair in Mr. Gray's chart. Is that correct?
That is correct, Lynn. Could you add with mesh to the operative report? And we had to use our backup pair of scissors, so could you ask them to put another one in for us?
Sure. I'll add with mesh to the operative report. The right inguinal hernia sac has been labeled with Stuart Gray's name and birth date, 11/11/71. And I'll ask them to put in a new pair of scissors before your next case.
Thank you.
Okay, does everyone agree that the rest of the equipment worked well?
Yes.
I have nothing else that we need to report.
Does anyone have any concerns for the patient's recovery and management?
Well, I think the surgery went well today.
And could anything have been done to make this case safer and more efficient?
Well, I'm glad we used the checklist. It was safer when we went to go check on Mr. Gray's allergies, and it also improved our communication.
I agree, Lou. And thank you for paging me about Mr. Gray's allergy. The incorrect antibiotic could have been a real problem. So let's move him over to the recovery area, and I think he should be able to go home this afternoon. So, Mr. Gray, how are you doing?
Well, Dr. Anderson, I'm doing okay. I'm not experiencing any pain, and from what I could remember during the procedure, everything seemed to go okay. Is that right?
That is exactly right. Everything went very smoothly.
Great, I'm glad to hear that. I'm also glad his operation's over. Everything seems to be going well. Dr. Anderson, I really appreciate your team coming in and talking with us before the procedure. And I'm really glad he didn't have a reaction to that antibiotic again.
That is exactly why we do the pre-op checklist, to find out anything we need to know to make it the safest possible procedure.
Mr. and Mrs. Gray, we want to make sure that you have everything you need so things keep going well for you when you get home. So let's review your discharge instructions outlined on this sheet.
Oh, before I forget, Dr. Anderson, I'd like to ask you if my husband might need some pain medication at home. Will we get a prescription for that?
Yes, you will.
And just to double check, has your husband ever had any problems or allergies to pain medicines in the past?
No, the only allergy we're aware of is his allergy to penicillin-type drugs. Will he need to continue on any antibiotics when we get home?
No, we gave him antibiotics right before the surgery, and that's all he needs.
Okay, good.
So, Mr. Gray, when you're ready to be discharged, we'll give you a prescription for your pain medication. Mary will also review with you and your wife instructions for taking that medication, as well as some recommendations that we have on restrictions on activity, like avoiding heavy lifting for a few months. Okay? Your discharge instruction sheet will list those restrictions, as well as a way for you to contact us should you have any problems. I'd like to see you in my office in 2 days to check on your incision. The office telephone number will also be on the piece of paper that we give you. So please call tomorrow and make an appointment.